In light of the discovery of a more infectious variant of COVID-19 coming from the United Kingdom, medical experts who met the president at the palace last Saturday believe mutations of the coronavirus may also happen within the Philippines. This is why the country's head of the Council for Health and Research Development, Dr. Jaime Montoya, believes now is the time to strengthen biosurveillance measures, especially in people they consider as having a higher risk of getting the virus.
For example, like clusters with increased cases, clusters with increased severity and deaths, because these are actually the indicators for probably new variants arising in the Philippine population.
And while the Philippines still has no recorded infections from the UK COVID variant, officials did not yet recommend travel bans from countries which already have confirmed cases of the new variant, like Australia, China, and Singapore, prompting netizens to question the move. World Health Organization OIC Country Representative Dr. Socorro Escalante says there are factors to consider in making such a decision, especially its impact on the already badly hit Philippine economy. She believes decisions on travel bans would have to be based on the level of evidence on the case, as well as how the coronavirus situation is handled in those countries.
So kung malakas po yung public health intervention ng isang country and the cases are limited to imported cases at wala pa naman pong community transmission, it is not going to warrant the declaration of a lockdown from that country.
Meanwhile, President Duterte has warned local officials to step up to prevent the new variant from spreading in their areas or face the possibility of stepping aside.
Ganito na lang, if they are not at par, in parity with the rest of the nation, di palitan natin sila. We do not remove them from office. We just step aside and assign the next thing, the persons who can do it, including the mayors.
The president also issuing another warning, this time to the United States, about providing millions of doses in vaccines to Filipinos if Washington wants to keep its visiting forces agreement with Manila.
Kung hindi sila makadeliver ng baski na lang in minimum of mga 20 million vaccines, they better get out. No vaccine, no, stay here.
Vaccine czar Carlito Galvez is eyeing 2 U.S. companies as among those that can help provide 80 million vaccine doses for the country. U.S.-based Johnson & Johnson, as well as Moderna, join Pfizer, AstraZeneca, and Novavax in his list. Galvez says they are also making deals with Russia's Gamaleya Institute and China's Sinovac for additional vaccine doses, while the president himself says some officials were already inoculated with the vaccine from another Chinese company, Sinopharm. Dr. Montoya reiterated that any vaccine should not be used unless it is officially approved for use by the Food and Drug Administration. Pfizer has already applied for emergency use authorization from the FDA last December 23. Paolo Barcelon, CNN Philippines.